Millennium Physician Group's Medicare Connect program conquers the confusion of choosing the right Medicare coverage for you. Be confident in your Medicare choices. Millennium's Medicare Connect gets you started in the right direction. Connect with us today at Medicare Connect at mpgus.com. That's Medicare Connect at mpgus.com.
I'm Michelle McCormick. Our conversation today is all about health insurance, what you need to know about making the best decisions for you and your family, what if you're aging into Medicare, and how to protect yourself from billing errors and Medicare fraud. We're also going to learn about accountable care organizations and how they benefit you. Millennium Physician Group is the largest independent physician group in Florida with over 150 offices in the state. We have primary care offices in 5 counties in Northeast Florida with over 40 providers to care for you. You can go to millenniumphysician.com to find a location near you. Join us right now for a healthcare journey as we work together to achieve the best health outcome for you. Our first guest today is John Risler. John is a veteran of the U.S. Air Force. His post-military career was mostly focused on labor relations and human resources. Since about 2011, about the past 10 years or so, John has been a volunteer with SHINE. SHINE is Serving Health Insurance Needs of Elders. We're going to learn so much more about that. Welcome to the show, John.
Thank you for having me, Michelle. Glad to be here.
I'm pleased to meet you. And this, I think, is a really a great topic because insurance really confuses a lot of people. And we're going to get much more into that later in the show. But let's first talk about SHINE. I think this is a resource a lot of people don't know about. Tell me a little bit about it.
SHINE is a program of the Department of Elder Affairs out of Tallahassee. It's federally funded through the Agency for Community Living. And our mission is to provide free and unbiased information about Medicare. And it helps people select the proper way to get through Medicare. We try to remove some of the mystery of Medicare. It also helps people reduce potential errors and fraud, find a way for them to communicate with somebody knowledgeable in Medicare that's not trying to sell anything.
Well, I think that's very important. I know Medicare, and correct me if I'm wrong, John, that 10,000 adults age into Medicare a day in our country. And the process is daunting. I remember watching my mom go through the whole process of Medicare. What got you involved with SHINE?
Actually, I had a neighbor who worked for Elder Source, who's the area agency on aging. It's hard to say, the AAA. And she worked for them, and she knew I was in HR, and she said, oh, maybe you should look into them because it's kind of what you used to do. And so I looked them up and contacted them, went through the training, got certified, and I've been counseling people ever since.
And it's a free service, right?
Yes, we don't charge at all for our service. All they have to do is call our hotline and tell their problem, and then it'll be assigned to a SHINE counselor. Usually in their county. We cover 7 counties in Northeast Florida, and we try to work that way, but not always. When you're working on the phone with a client, they don't care what county you're in.
Right. I think
as long as you're helping
as
them.
long as you're helping them out. Agreed. John Risler is our conversation right now about SHINE, Serving Health Insurance Needs of Elders. So, John, who is the SHINE audience? Who do you actually serve? Are they only 65 and above, or are we looking at folks in their 50s too?
We primarily deal with people over 65 or people approaching 65 who have gotten things in the mail indicating that they're eligible for Medicare in a few months and don't make any mistakes and buy this and buy that. And they call and they're confused. We also help people each year during the annual enrollment period where people can change their coverages. And I might also point out to your audience that our audience is concerned about cost because Medicare is not free. It's a myth. And we try to get them to the lowest cost or a cost that fits their financial situation by telling them what the options are.
Right. And what are some of those options, especially for the folks that are on a strict budget as they age into Medicare?
Okay. There are 2 basic ways to get through and to sign up with Medicare. First, you have to sign up through Social Security so that you're in the Medicare family. But then you can cover the cost that Medicare doesn't cover. It only covers 80% of the amount that Medicare deems reasonable for each procedure. So there's extra cost. One way is through a Medicare Advantage plan. These are insurance packages that actually replace Medicare. They provide all the benefits of Medicare by law and more so. And they do so from a payment by Medicare to the insurance company per signee, per person who signed up. And you can get these plans from most any major insurance company. They usually have no premium, which is good for people on a fixed income. There's no monthly regular cost. There are copays, however, and there are some doctor and hospital selection differences between the plans. So we help people steer through those using the website medicare.gov. The other option is to go with original Medicare, and to cover the excess cost, you could self-insure it, or you can buy a supplemental insurance policy from an insurance company that will cover part or all of the difference between what Medicare pays and what the doctor charges. Okay. In addition to that, you will have to buy a drug plan. So you must have a drug plan. It's very important you sign up for a drug plan, either through an Advantage plan that includes drugs or a separate drug plan, because there are penalties for late signing up for those.
John is joining us, John Risler from Shine, serving health insurance needs of elders. And it's also very confusing. And that's why I think a show like this, the conversation, benefits a lot of people. And I see, how many calls do you think you guys get, or inquiries through a website, to connect with you as they're trying to weed through all the different layers of Medicare?
The calls vary by time of year and month. We get our most calls in the open enrollment period from October 15th to December 7th. And we'll probably in our area handle between 2,500 and 3,000 calls. But other months can be much less, depends on what's going on. During COVID, we've noticed a big drop in calls. I'm not sure why. We've tried to figure it out, but no one seems to know. It's just people are kind of hunkered down and not doing much, I guess. Yeah,
we being in the primary care business, we definitely want to encourage people to continue to see their doctor, and it's not a time to put that aside, as well as your insurance. John, let's talk a little bit about the Senior Medicare Patrol mission, which is SMP. This is something you're also involved with.
Yes, we Shine and the Florida Department of Elder Affairs got the grant for running the SMP program a couple years ago. And we went from 50 people in the state to over 500 eyes and ears, people out there in Shine land who feed information about possible fraud and scams or other billing issues to the SMP. We have a small group here in Northeast Florida that research these complaints, help people file their complaint with the proper authorities. But our primary mission is to get the word out to people on how to avoid these scams in the first place. And before COVID, we did that through live presentations to groups at luncheons or dinners or various meetings. Now we try to do it through people like you who reach people on the radio or on TV.
Right. And what is an example of a potential scam that a patient with Medicare could fall into?
There are a couple that have been real popular here in Florida. We are the biggest scam state in the United States. We have more scammers here and more people fall victim. One of which is called the Durable Medical Equipment, DME. It's things like walkers and canes and wheelchairs and braces. And the scammers call your home phone. they ask you how your back pain is. And if they catch somebody that has back pain, they go, oh man, well, I can send you some braces for that, and, cure you right up. And, well, how do you do that? Well, you just give me your Medicare number and I'll have them there in no time. And so the person gives them the Medicare number and their home address, and they might even get a back brace. But that Medicare number is used on multiple orders signed by physicians who aren't very noble, sent into Medicare. Some of the back braces run $1,200, $1,500 a piece. You multiply that by 10 or 12 orders, and you deliver one and pocket the money for all the others. It's a multi-million-dollar problem just in that scam alone.
Wow, that is super frightening that is the case. And I'm hoping part of the education that you do with the SMP is educate folks on not giving out your Medicare number.
Absolutely. You should treat your Medicare number like a credit card, and you should not take it with you except if you're going to the doctor. So reach in your purse, reach in your wallet, take the Medicare card, stick it in a locked box in a closet, somewhere where if you lose your wallet or your purse, you're not going to give somebody free rein to charge Medicare for things that you don't want.
Right. I totally agree with you. John Risler is our conversation at the moment from Shine, Serving Health Insurance Needs of Elders. And we're also talking a little bit about the scam awareness that some people fall victim to, and how the Senior Medicare Patrol really tries to reach out and educate folks on how not to fall victim to scams. What are some ways that people can learn more about Shine and SMP?
Well, there is a Shine website, Florida Shine. Here we go. I didn't look it up. .gov or .org. I can't remember which. If you type in Florida Shine in your Google search,
it came up when I looked it. So yes, right. Florida Shine.
So you can find it there, and there's all kinds of information there for the public to browse through, pamphlets. You can go on to Medicare.gov and type in the search box scams or fraud or whatever, and there'll be information there.
And these scams are also at like health fairs, for example, like if you go to a senior expo, or if you're just kind of going out and trying to reacclimate after, post-COVID, perhaps you can fall victim at those type of events as well.
Right. And one of them is particularly appealing. We've gotten used to seeing people have swabs stuck up their nose to test for COVID. Well, the scammers, they want to test you for DNA. They want to test you to see if you're susceptible to cancer or perhaps allergic to certain prescriptive drugs, so that you can know in the future. And wouldn't everybody love to know that? So they take out this tube, they pull out the swab, they swab your nose just like everybody's seen on TV, and then they put that swab into another tube and send it off supposedly to be analyzed. It probably goes in the trash can. But the order for that test is sent to a legitimate lab. Well, I say legitimate, they're crooked. And they send back to Medicare a charge for about $11,000. Okay? Everybody up and down the line, including the guy that swabbed your nose, gets a cut of the action. So there's him or her involved, and many times they think they're doing something legit. They're not even told it's illegitimate. There's the middleman who collects all the data. There's the doctors who get bribed to sign all these forms. And then there's the lab people who phony up lab results or don't even send lab results. And it's really easy to get caught up in that. Now your Medicare number is out there.
Goodness.
If you get caught in any of these scams, or you think your Medicare number has been compromised, you need to call 1-800-MEDICARE and report that, and they'll get you another number.
Well, good. 1-800-MEDICARE. That is a great number. How can we get in touch with you, John, for folks that are interested in learning more about Shine? What's your number?
Our call center number is 888-242-4464.
All right. One more time. 888.
888-242-4464.
All right. Well, John Risler, thank you so much for joining us today.
Millennium Physician Group's Medicare Connect program conquers the confusion of choosing the right Medicare coverage for you. Be confident in your Medicare choices. Millennium's Medicare Connect gets you started in the right direction. Connect with us today at Medicare Connect at mpgus.com. That's Medicare Connect at mpgus.com.